Before we do that, my guests, let me remind you, Amref Health Africa Group CEO, Dr. Gitahi Githinji is over there. The CAS for Health, Dr. Mercy Mwangangi is in the middle. And Professor Omu Anzala, virologist at the University of Nairobi, the experts on corona. There's a question here, folks. There's a quick question. Let me go to it here. It's from Seros, or Seros Silas. Says, new research shows that the virus survives in air for hours and for days on surfaces if the spraying is to be done across the country. How long does the spraying last in the air to curb the virus's survival, or on surfaces, and due to shortness in breathing, what should one do to sustain? Dr. Mercy, what do you have to say? How long does it last?
So our most recent interaction with the Chinese, which was earlier this morning, the Chinese inform us that the virus lasts on surfaces, not in the air, on surfaces, and this can be for a period of 6 to 1 day, 24 hours. And the studies are going on to ascertain this. So remember, it's a new virus. We don't know everything about it, but so far the Chinese this morning confirmed to us that the virus does land on surfaces and stay there.
Dr. Gitahi, is that why you keep saying social distancing is important, and why sanitizing and washing hands, is that why it's very important?
This is a community and individual response, basically. So the Ministry of Health and the epidemiologists are tracing contacts, testing them, but we can't just sit and wait. So our message to the people is that everything in control of this virus is in your hands, actually. And the way you have to do it is understand that the infection possibility exists. So I've had a lot of people saying, you know, I talked to Mama Mboga, she said this thing is a lie, they're calling it all sorts of things, and they'll take garlic, they'll be safe. Forget about all those things. You've heard from the, from the people here that the surfaces are the danger. So if you touch or if you cough into your hand or then you shake a hand, then it's transmitted. So wash your hands. Avoid coughing into your hands. Wash your hands, okay, and don't touch your face. Wash your hands and keep safe distance from people. Basically, we know from what you showed, social distance is very difficult from where we live. So we also have to realize that when we advise people, we have to advise them within the context in which they live. So within the difficulty that we live in, hand washing and avoiding shaking hands is a big way forward, even within where you can't afford social distance. So keep washing your hands, don't shake hands, and just that is the best advice that we can give to people. Professor, real quick, you want to add to that?
Yeah, we also need to correct that statement.
Go on.
There's nothing like spraying, unless it's talking of disinfection of
and fumigation.
There's no spraying of the air.
Okay.
There's no mechanism of that nature.
Good. Thank you for that correction, Professor. Let me ask you real quick. Why the elderly?
You know, the elderly is because as we grow older, we tend to go down with a lot of comorbidities. By that I mean hypertension, diabetes, heart disease, asthma, things that come with age. The immunity also begins to wane off, all right? So all these things come with old age, okay? Even the ability to breathe very well and clear the secretions is actually slow. And you'll actually see from those, the infection and the pathology, what this virus is doing, that as it reacts in the lungs, the individuals who are infected are actually drowning in their own secretions.
True.
Yes. They are simply, and it is because it's due to the fact that with age, everything slows down.
Yes.
And that's why you see that in the elderly, there's actually more mortality than in the young.
People were asking, so why not infants then? Why not infants?
Infants, we don't know. Because, Jeff, if you again study the demography that has come out and the people who are being infected, in those countries, there are very few children. Yes, let's be clear. It's now hitting Africa where the demography is quite different. If you look at our curve, how does it look like? Isn't it? Yes. It is actually skewed towards what?
The elderly.
The young. The very young. Isn't it?
Because we have a young population.
Yes,
the
exactly.
dividend,
And you see, just to give those who understand a bit, this virus is behaving like one of the viruses we see that has a lot of problems in under 1 year. Respiratory syncytial virus. It actually major problem in the very young, but as we grow older, it is less and less.
Dr.
Same
Gitahi,
thing.
you wanted to add to that?
Yes.
You wanted to add?
No, I wanted to say exactly what Professor Nzala has said, but I would also like to think that, you know, and I'm now simplifying this. I'm not a virologist. I'm simplifying this. That as we grow older, our organs wear and tear over time.
Sure.
And if you to just put, and this is, I'll leave Professor Nzala and his team to go and confirm my theory. This is purely anecdotal. That in my thought, if you're driving a car that has a worn tire, you're more likely to get a puncture than if you're driving a car that has a well-treaded tire. And I actually think that the integrity of the lungs in the elderly, because over time, the integrity of the lungs wears over time, just like other parts of the body. That's why the older have arthritis and that kind of thing. Then it's more vulnerable to the attack that it's not able to resist the virus. When you're younger, your lungs may be more, and that's purely anecdotal.
Exactly.
And so, Dr. Mercy, is this what you call an opportunist virus? Is it an opportunist?
So, I like that, Jeff. I think you can join this bench. I think you're welcome now. I think now you can join this bench.
We'll give you a small certificate.
Exactly, Dr. Jeff. So yes, indeed, this can mimic opportunistic infections. Remember, when someone has a compromised immunity, HIV patients, diabetic patients, patients who have SLEs, all autoimmune conditions are vulnerable. But Jeff, I'd like to dispel one myth. In China, again, from our learning conference that we had today, there are children in China who've been affected by this virus. So it's necessary for us to be aware right now. We are still learning who can be attacked by this virus. And therefore, the most important thing, as the two doctors have said, is ensuring we put in place prevention measures. Because we are learning. We are learning. It's an evolving journey.
Sure.
So we need to protect children and the elderly as well.
Absolutely. Folks, hold the thought. We're going to come back. We'll take a quick break. We still got some sports news to do, corona-related. And then after that, we can sit down and have a proper chat.